so that can look very differently from person to person. For me, I really like just merely sitting in silence and trying to pay attention to the sounds that are going on in the background, the smells, what the taste, the feel that I have. And that just 15 minutes of really sitting and doing nothing at all is a form of meditation. And even to do that, that centers me and brings me out of my fast-paced day-to-day sort of experience. And so it's
Is
just,
that also known as grounding?
well, I mean, it's called different things, and certainly to ground oneself or to center oneself, those are all synonyms. So yeah, yes, it does certainly capture that as well.
Because excuse me, Lady Gaga earlier on another program talking about her mental health diagnosis, and part of her coping skill includes grounding. And she used, and let me try to remember, the initials are dialectic, DBT.
DBT.
Can you talk a little bit about that and what kind of
Yeah, well,
diagnosis it is? Because the coping skills sound pretty, pretty good, like helpful. And I think she was talking about grounding, but
okay. So DBT, or dialectical behavior therapy, is a form of therapy that's used specifically for borderline personality disorder. And so I'm not sure how much we want to go into this,
okay.
but I'll just say this, is that depending on what your personal diagnosis is, there are specific therapies that are going to be very helpful for you in terms of grounding yourself and bringing yourself back down to earth. And so that's just kind of one. Certainly, it can, the strategies can apply to anyone, but that's a very specific one for borderline personality disorder.
Okay. I understand. So I do like the idea of that, creating that calm and that finding that peaceful time in the day after a day of ramped up, high stress related work, which a lot of essential workers are experiencing right now, going to work in a whole new set of circumstances that are more threatening than anything.
Sure. And I think we should also expand our definition of essential workers too. So certainly it includes hospital workers and doctors and nurses and medical healthcare staff. But as you alluded to earlier, it also includes restaurant workers. It includes housekeepers. It includes gas station attendants. And so it does include a lot of other folks. And so let's try to focus on what would be the common elements of all of these essential workers. Certainly it would be long hours, right? So in this day and age, you're going to have people calling in sick. You're going to have people who decided to quit. You're going to have people who, for whatever reason, just aren't there. So now you're being asked to work a double shift instead of your regular shift. So that's a big piece of it. The other part of it is just the fear and anxiety that you might be, or you may have exposed yourself to someone who has coronavirus, and you are going to bring that home to your family. That is something that is a very common element. And it goes hand in hand with the feeling as if I'm doing a very honorable job here by sticking to my guns with this position that I chose. But alternatively, I also feel like I'm really worried that that person that came into the gas station or into the hotel that was coughing may have, somehow gotten sick.
People have been doing that ever since we were ordered to stay at home. Sure. And so is there any other piece to that you can think of that essential worker can use from the time that they walk out the door or to the time they return home that they need to remember and keep in mind that's going to help them just get through it on a daily basis? What's really
Yeah, I kind of alluded to just a bit of the concept of positive psychology, and I guess let me expand on what I mean by that. That's a very broad subset of our field, but it also includes a lot of cognitive work. And so, excuse me, if an individual is severely or even moderately fearful that them continuing to go to work is going to somehow make them sick, is going to make their, sick grandparent who they live with sick, and they be the responsible party for death. That's a pretty big amount of
Yes.
pressure
And
that you have on yourself, right? Like, we're not
ooh,
talking about you give someone the flu and they're out of work for 2 weeks. That comes with its own, amount of stress and guilt. But if you really know and you believe that coronavirus is something that's been certainly taking out a good number of people, then you understand that by you continuing to work, the possibility does exist that you might die and that your grandmother might die, or your aunt or your uncle, whoever you live with, even children. Children have not gotten a lot of news about this, but certainly there have been children who have died as well. And so that fear and anxiety is fueled by our thoughts. And so imagine that you go to work and you are saying to yourself, your conscious is saying, oh my God, by me going to work for 3 weeks in a row, I know that I ran across someone who has coronavirus, or I know that at some point this is going to catch up to me and this is not going to be good. Imagine what that's going to do to your emotions. That's going to make you more fearful and more anxiety provoked, right? And so what we have to do in those examples is we have to figure out a realistic and a actual way in which we can combat those negative thoughts with something more positive and something more realistic. It's not like you're coming up with a fake, positive jingle, but in that same example, what one might say to themselves is, I've chosen this industry and I find it honorable for myself to continue to go to work. And if I do find myself with any symptoms at all, I will address it and I will get tested and I will take appropriate action. That is a healthy cognitive reframe in response to the example that I gave earlier, where one is kind of inundated with fear and anxiety and they're letting their thoughts or their cognitions kind of take over. And so that, my recommendation is to first be aware of your thoughts and first be aware of which category they fall into. Are you really, inundated with negative thoughts? Is that actually your case? Or do you have a healthy balance of a little bit of fear and a little bit of positive thoughts as well? I mean, not everyone is going to fall into the category of psychopathology, but the moment that you find that your heart rate starts to increase, that you're having heart palpitations, sweaty palms, feeling as if the world is coming down on you, trouble sleeping, trouble eating, when you start to notice a cluster of symptoms, that's when it's about time to kind of look a little bit deeper.
Great to know. Okay. I think that's enough for everybody to hold on to.
Sure.
And so let's move on to the next subject, which is in relationship to what you talked about last, being responsible for the death of a loved one. I actually have a friend who works in the medical field, and she has been working throughout the stay-at-home uh, orders that have been placed on everyone. She's been using personal protective equipment, the full mask, and everything completely covered. But her mom was exposed in the facility, a senior facility, and not by her. Exposed in the senior living facility. And she lost her mom. She buried her mom last week.
Wow, I hate to hear that.
So with all that she was doing to protect herself and her family, her mom wasn't protected in the senior living facility, and she lost her mom. And
wow.
So, to her, she couldn't talk about it. She couldn't talk about it. She didn't tell me when she lost her mom right away. When she was finally able to express to me, she had already, accepted it and was already preparing for the burial and all of that of her mom. But I don't really know what to say to her. Um, I can't imagine what she's going through. What can you say to anyone out there who's lost a loved one like that and to COVID-19, whether they think they were the reason for it or not, or, with with the problem of the senior living facilities having, having some real problems with protecting the seniors that are there.
Let me say this first. When someone such as your mother, who, and especially if you have a very close relationship, there's ultimately nothing that you can say or do that's going to be a soothing sort of factor. There's nothing that's going to bring this person down from their grief and their loss. And so we all have to understand and recognize that piece first. What we can do is we can offer support. We can offer our love and our understanding if an individual is open to that at the time. What we want to avoid is trying to provide and create solutions that we're not sure that the individual is ready for. Um, that's a tough one. I mean, within the Black community, we tend to, when someone passes away that's a close friend of ours, we tend to offer food for them. Like, it's going to be hard for you to cook.
Right.
I want to take something off your plate. That's an essential activity that we all do, is nourish ourselves every day. And that sounds like a good idea, but in some cases, someone doesn't even want to open up the door. So you have to at least be a little bit aware of what someone is willing to accept and what they aren't willing to accept. And
Yeah.
if food is something that they're like, you know what, I really appreciate that. I will, I would really like for you to, send food over, for example. Um,
But
that's
in this case now, we're locked down and we're told to stay at home unless for, unless it's for essential needs. Now, maybe a bag of groceries instead of preparing the meal and taking it in or something like that, maybe.
well, you're right. And so there is a difference between, outside of COVID-19, when someone passes and you dropping over and dropping some food off. But even within our restrictions, food delivery and takeout is still very much an element. So, you know,
Yeah.
unfortunately, that's an essential worker as well, someone who's a food delivery person. So we kind of
Yes.
utilize that as a tool in which you may decide to do a good gesture. But ultimately, just kind of going back to my point,
Yeah.
you have to not impose what you think someone should be willing to do at that time onto them. I can just remember, I've had a couple friends who are really big on phone calls instead of text messages during a time of loss. And that can very well be a great strategy for that individual. And for
Yeah.
some other people, they may not want anything at all. And so you can't take what works for you and say that you're going to do this as well. I know what's best for you. And so we just have to really respect what people are willing to do. And some people are completely open. They're like, you know what, this has happened, and I do need a lot of love and support, and I do want you guys to reach out to me. And in that sense, now you got the green light, and you know what you can do.
Okay, so now just thinking about the loss of a loved one who, and this is part of what she experienced. She couldn't visit her mom, she told me,
Mm-hmm.
because, her mom was isolated and quarantined.
Mm-hmm.
And so she couldn't say goodbye in the last hours.
Yeah.
So how can you see that being a little different from the typical ways that people are mourning and dealing with death? And what can you tell them about that difference now, this
Sure.
new normal?
Sure. The only analogy that I have is, let's say that someone passes away in a car accident. And
Mhm.
so, and maybe this is someone who you don't really speak to that often, maybe once a week, but they pass away in a car accident. You did not have a chance to say goodbye. You did not have a chance to resolve if you had any issues between the two of you is just over and done with. And so this sounds very similar to it, although I'm assuming that there at some point were some phone calls, but you can only imagine what that's like to know. And I'm assuming that it was communicated that her mom had COVID-19 and they were treating her for it, but she's quarantined and you can't come see her. Like that is probably the worst situation you can imagine. I can imagine and believe that some people are going to completely ignore the mandate and try to break in and bust those doors down. I don't care what you say.
Yeah.
It wouldn't totally surprise you if someone were to do that because this is a close
Your
family
parent.
or a parent.
Yeah.
But that's really tough. The only thing I can say is that that individual is very likely going to experience higher level emotions. So where the average person is experiencing grief and loss, this person may also experience guilt or shame that they put their parent into a housing community to begin with, when maybe that was one of several options.
Wow.
And so they just have to be prepared for the additional emotions that are going to be on top of it.
Yeah. And that's a thought that has crossed my mind. How are the family feeling? How they're feeling about having put their loved ones there in the first place? Yeah.
Mhm.
Um.
And
And
let me just touch
so,
upon that just for a moment. That's it feels like it's a more common thing happening now than
yeah.
anything in these senior communities where huge numbers of people are passing away. I mean, for one,
Yeah.
you have people who already have a lot of the predispositions to
Right.
COVID taking them out, and then they
Yeah.
also have the age factor, and then you also have I'm making an assumption here because I don't work in this field, but I assume that you have shift one, shift two, shift three. So they're getting, these folks in these houses are getting exposed to a pretty high number of people who are going home and who are coming back and so forth. And so it's just kind of the perfect storm
Yeah.
for this to really be problematic. And I've heard about, I think, 3 nursing homes so far that have had kind of outbreaks in a way.
Yeah. A much bigger problem than we can imagine.